Hi everyone, my name is Gilbert Munyemana. I work for the National University of Rwanda in the Center for Instructional Technology. I first of all thank the organizers of this online conference, Image 2012, which has given me the opportunity to share with you what we are doing in the field of e-learning, building capacity in the different sectors. Today I'm going to talk about harmonizing capacity building and work responsibilities of Rwandan nurses through e-learning. And my presentation is going to talk about the background and the rationale of the project, the implementation process. I'll talk about the achievement to date, challenges and remedial actions. I'll end with the conclusion. Before I start talking about anything, let me first of all give the information, the basic information on Rwanda, which is like the case study of this presentation. Rwanda is a landlocked country situated in the Central Africa, which is one of the small country in the region, where it has the land area of 26,338 square meters, and the population is approximately 12 million. The borders, we have Uganda to the north, Tanzania to the east, Burundi to the south, and Democratic Republic of Congo to the west. As you can see, the country has the 5 provinces, which are the Western Province, Northern Province, Eastern Province, Southern Province, and then the Kigali city. Continuing with the background and the rationale, I'm going to give you the indicators of the population and medical personnel, as I'm going to talk about the use of e-learning in educating nurses. I have to talk a little bit about the health sector in Rwanda. As we said, the statistics that we are using here are from the 2002 census, where we had more than 10 million. With those statistics, we can see that the doctors, we have one doctor over 18,000 inhabitants. And regarding the nurses, which we are going to talk about the education in this presentation, we have one over 1,476 inhabitants. In 2008, 62% of them were in the rural area. But in 2010, 78 are there. 38.2 of nurses in urban area in 2008, and then now in 2010 there were 22. As now we are going to talk about how e-learning is helping in educating nurses in Rwanda. Let me just give you a short background on education of nurses in Rwanda. Before 2005, education of nurses in Rwanda was organized within general secondary education, awarding the A2 certificate. These are the 6 years of secondary schools. And those graduates were subsequently employed as associate nurses in different hospitals and health centers in Rwanda. But in order to improve the quality of education and services in the health sector, the government of Rwanda ruled in 2007 to stop A2 nursing students, which had the associate nursery level, and instead start training A1 nurses, which is equivalent, they're going to have a diploma level in 2007. Nowadays we are having 5 government schools of nursing and midwife, which award A1 diploma. These are different locations, one called Nyagatare, Chibungo, and Rwamagana. These are in the and the Byumba and Kabgai. They are in different provinces of the country. These existing full-time programs in the 5 schools of nursing and midwife only admit about 100 A2 nurses per year, which means the A2 nurses who want to have A1, the 5 school can only admit 100 of them. And according to the National Council for Nurses and Midwives of Rwanda, this we refer to the document we had in 2009, about 5,000 nurses and midwives were working in the Rwandan health sector. These 5,000 already have the A2 level, which means that they are now not qualified to work in the Rwandan health sector. This brings in the problem of capacity building and work responsibilities. How? Those people, those 5,000 nurses working in the health sector in Rwanda, they are experienced, but they are obliged to have the A1 level. These are challenged to go back to school for upgrading their level, but they did not want to quit their jobs, as there are some of them the head of their families and so on. And the Ministry of Health could not afford to replace them without paralyzing the functioning of hospitals and health centers. This raised 2 fundamental questions. The first one was, how can we mitigate 2 conflicting obligations, namely capacity building and work responsibilities? The second one was on how to train the existing nurses and new ones to meet the Millennium Development Goals with a limited capacity of existing nursing schools. And in collaboration with the National University of Rwanda through its Center of Instructional Technology, the Ministry of Health embarked on e-learning for educating nurses, which started with 320 students on board in 2012 academic year. And now let's see how these have been implemented. And this is the center of my presentation. It started with defining objectives. The broad objective was to promote the quality of nursing and midwifery health services in Rwanda, with 4 specific objectives. The first one being to improve nurses and midwives' knowledge and skills using the modern methods of teaching and learning, to equip different health settings with well-trained and qualified nurses and midwives, to contribute to the reduction of infant and maternal mortality rate, which is one of the Millennium Development Goal number 4 and 5, to have upgraded and qualified about 1,500 nurses and midwives by the year 2020. The implementation process started with the verification of requirements. This verification of requirements focused on infrastructure and facilities, curricula. The infrastructure and facilities was to see how these people are going to the infrastructure to set up the e-learning platforms, but also in different fields to see how this can be accessed. This includes the computers and internet, but also on the other side, the servers and so on. Curricula, the content organization, approach to teaching and learning with Moodle and assessment. Here you had to see the existing materials and then their convertibility into the online materials. The ICT skills was another component. I can say the e-readiness. This is the computer skills for teachers and students, the knowledge about the e-resources and online databases. After this verification of requirements, which took like 2 weeks, a report was released by the National University's team, and then give different recommendation. And then those recommendations have been considered to facilitate the start of the program. This included the purchase of different ICT infrastructure. This was like to improve different materials owned by students, and the organization of trainings where the students or teachers were not well trained. After the ICT infrastructures put in place, the e-learning platform was put in place. But which platform did we use? After pedagogical and technical evaluation, Moodle learning management system was selected. Mainly looking at its functionalities and also its openness. But also on pedagogical side, the Laureate's conversational framework was the main evaluational tool. To just give a small definition on Moodle, Moodle is a web application developed as a set of tools which can serve the world community to achieve educational objectives in completely online or a branded learning environment. A branded learning environment being the combination of face-to-face and online delivery. These kind of platforms are also known on the name of learning management system or virtual learning environment. Now the e-learning platform for nursing education in Rwanda is available and then is hosted on Ministry of Health servers, and then this is the URL. This is a small screenshot on how it looks like outside. With the platform, teacher can create online courses, like they can upload files in different formats, this being the PowerPoint presentation, the Word document, and video, audio, and so on. They can initiate online collaboration, which is very crucial when you are giving an online, when you're giving any kind of learning program. They can create forum chats so that they can interact with their students. This helps a lot in answering different questions that have been asked, and then helping each other to understand different materials. They can create different learning activities. They can just put assignment. They can put different other learning activities which can be used by students. The assessment, the student assessment, as well as the class administration. Okay, and on the student side, student can also access learning materials at any time and from anywhere. They can just engage in online discussion with other students and teachers. They can upload the accomplished work for assessment. They can share interesting materials with others, as nowadays people can have different source of information. So sharing is one of the power of e-learning platforms. After putting in place the e-learning platform, the training was very, very, very needed. The teaching staff, first of all, because they have to prepare materials, they have to prepare courses to be accessed by students. How this has been done by training the existing teachers of 5 schools of nursing and midwife. during the training they were asked to bring the materials in the soft copies, so that during the training what they have been doing, the output of their training will be a ready a ready to use course, which can be improved maybe with a second session. The IT officers, the different 5 schools have already IT officers. These IT officers had to be trained, because they already have some IT skills, but also they have to understand how the Moodle works, so that they can support students and teacher and train new other teacher who have not been trained in the first or the second session. The IT officers, in collaboration with the National University of Rwanda team, trained also students along the e-learning program on how to effectively use the system. The students' admission was done by taking, first of all, 140 head of health centers countrywide, and then be enrolled in e-learning program, because most of them had the A2 and then they have to have A1, as they really play a very big role in the health and providing health services. In addition to those ones, 175 nurses were selected based on the criteria of passing the entry examination, which was organized by the Ministry of Health in 2010. I think here 180 were admitted, because but other 5 had dropped out in the beginning. Being registered in the National Council of Nurses and Midwives is another requirement which have been considered. And considering that students will be using a lot of computers and internet, it was a requirement for each e-learning student to have his personal computer, and if possible to have also a modem to facilitate their accessing internet and their place of work or home. The program structure and organization of the content. This e-learning program shall run for a period of 3 years, divided into 6 semesters, which means 2 semesters per year. The program is conducted in modular system and then using a branded type of learning. Normally the full time of this program lasts for 2 years, but this considering that the students are not there full time, it have been done for we have considered 3 years. The program is structured in such way that 80% of the program will be delivered online via e-learning platform, while students are at their respective workplace, whereas the rest of the program include face-to-face contact session at School of Nursing and Midwife. Here I have to precise that students will be working in different hospitals and health centers in all the provinces in the country. But for the face-to-face sessions, they have been divided in those existing 5 schools, where like 50 will be in one school, other 70 in another school. So they will be having like 20% of the time they will go and spend 2 weeks in the different schools. But lecturers of each courses are going to facilitate them. They are accessing one course which is having 5 facilitators, one facilitator coming from each of the schools, and then when they are going to face-to-face sessions, they will be facilitated by that lecturer who has participated in the construction, in the development of the course during the training, with other colleagues. They are in one classroom, but they will be having face-to-face sessions in different schools. The Ministry of Health has arranged that nurses be facilitated to attend those face-to-face sessions without affecting their daily work. And during face-to-face contact session with lecturers at teaching institution, students benefit from the available resources at schools and the nursing and also the schools of nursing and midwife, including lecturers, libraries, internet facilities. Students are also provided with learning aids developed at school, including course handouts and so on. And during the same face-to-face session, students will also have practical session in skills lab at schools and undergo a session of integration of clinical competencies. This is a form of a continuous assessment of clinical learning and knowledge construction through integration of acquired clinical skills and competencies with theories. The achievements to date is that the e-learning program for Rwandan nurses education commenced on 2nd January 2012. This was the launch of the courses, but the official launch have been done on 14th February 2012. The first intake of 320 in the 5 schools of nursing and midwife, but currently we're having 314. 5 of them dropped out in the beginning, and unfortunately one of our students passed away. The improved teaching skills for the teachers of schools and nursing and midwife, where at least 10 teachers in each school of nursing and midwife have been trained in designing and developing online courses. But the training goes on because they are having, before each face-to-face session, different teachers from different schools gather together to make a common course, which makes it well improved because everyone brings his own expertise and they put it together and then they agree on the course to be taught, on the content and assignment and activities and everything. All e-learning students have been trained, and now they have completed 5 courses. An evaluation of their learning process is planned before the end of this year. Now we cannot just say that everything is going well. There are some barriers. The first one is language barrier, where some students they have started in French and then they're having problems with English. So the teacher of nursing school are putting more emphasis on teaching English, and then the National University of Rwanda is also working hard to develop computer-based self-teaching materials to ease English learning. The nursing and midwifery school teaching staff are now overloaded because now their workload has doubled. The Ministry of Health is finding a way to mitigate this problem. And internet connectivity is still low in some parts of the country, but the Ministry of Health, in collaboration with the national service providers, is working on these issues. Some students travel long distance from their workplace to where they attend, and that's why there is a plan to add 2 more learning centers. By concluding this, I can say that the A2 nurses, the program to upgrade these nurses is very important to strengthen the health sector in Rwanda. Through this e-learning system, students learn at their own pace with more flexibility. This will benefit individual students because they will continue to work and salaries at the same time studying and then stay close to their family. It will also benefit the health care facilities in terms of continuity of care. All stakeholders currently involved in the project deserve a considerable recognition for their tireless efforts being invested. The journey is still long though, and any contribution to support this initiative is welcomed. With the commitment of all stakeholders, the project will achieve its objective and help Rwanda to develop through a healthier population. Let me end by saying thank you and then sending you regards from Rwanda, and then with these also beautiful pictures which gives you an idea of how the landscape looks like and the animal. Thank you very much, and I welcome questions and reaction on my presentation. Thanks a lot, and thanks to Image 2012, and thanks to organizers.